everyone. So for this video, we are going to administer the intradermal injection for our patient. So for the intradermal injection, asa na siya dapit? So dirira na siya sa skin, which is 10 to 15 degree of angle ang atong pagkuan niya. 10 degree angle. So for this is we have here the assessment. So what is the assess and how we assess the administering intradermal injection for our patient? We determine the appearance of injection site and then specific drug action and then expected response, client's knowledge in drug action and response. Next, we are going to check the use for the protocol about the sites on to use the skin test of it. Because intradermal mo ni siya ang kanang injection niya for skin lang siya, skin only. So, how do we plan? What are the equipments of this? So, client's MAR or computed printout. Next, vial or ampule. So I have here some sterile water, which is the vial. And then also using the syringe, which is ang ato syringe na gamiton is the tuberculin syringe. So I have here some tuberculin syringe nga. Kailangan nato 1 ml ang ato ang ibutang area. So mga 1 ml. So ato ra siya ikuan niya. Then also alcohol swabs. Wala ko alcohol swabs, but I have here some cotton. Then atara siya ikuan. And then 2x2, which is sterile gauze square. So I'll just gonna assume nga ito ta. And then also clean gloves, which is according to the agency protocol nga needed kaayo. Bandage also, and then epinephrine on hand in case in the allergic, and then anaphylactic reaction. So now, we are now going to implement the preparation for our patients administering intradermal injection. So right now, we are going to perform the administering intradermal injection or the skin test for our patients. So first is that we are going to perform hand hygiene for our patient. So first is hand hygiene lang sa ito. Okay. And then also we are now going to use clean gloves. And sir, mag-hand hygiene lang dito sir, while I'm going to use clean gloves. Go clean gloves. Dikot-tigo. Isa ha. Wala ko dali. Lisod ba yan eh? Okay na. Ay na po rin. Lisod pa promise lisod niya siya. Mag-anak naman ako.
Paborot mo sa galing mo?
Yan na. Hindi na siya paborotin. Ano dyan na siya. Ay, tawa. Alright. So now is that we are going now to prepare the vial or the ampule for the drug withdrawal. So we are now going to use the tuberculin for our patients, which is here. And then now we are going to withdraw. So now is that here. So, kailangan nato 1 ml ra ang atong i-withdraw sa tuberculin. So, 1 ml. And after that, so for this as we prior to performing the procedure, we are going to introduce self to our patient and then verify the client's identity using the agency protocol. So, sir, my name is Lyan C. Baril and I'm your nurse for today. So I'm here to performing intradermal skin test for you. So is it okay?
Okay.
Okay, sir. Wala ka nakulbaan?
Gamay pero okay.
Okay ra. So we are going to explain to the client that the medication will going to produce a small wheal. So bali, it is sometimes called a bleb. So sir, as we go along, sir, after we go along, after the procedure, makakita ka unay mo laboratory, which is a blood. So, okay naman ni mo, sir, no? And then, it will not affect on it. So, a wheal is a small raised area which is like a blister, and then the client will gonna feel slight prick as a needle enters the skin. So, some medications are gonna absorb slowly through the capillaries, which is into the general circulation. So, on it. So, now we are now going to procedure, and then select the clean side. So, first is that we are now going to clean the patient. So, dilidapit. Alright. And then, so this is the forearm of our patients. And then above the wrists, and then she's going to 3 or 4 widths, and then below the antecubital. So here, dilidapit. So, may tataog, butang taog, mark. And now we are going to avoid using the sites that are tender, implant, or swollen. Just the patient. So now, I'm gonna apply. Right? So nadiridapit. So now let's just assume that this is the arms of the patient, just like I did here. So, sir, can I lift up your arm? Yes, po, sir. Thank you for cooperating. We will now gonna get the tuberculin. So I have here some already tuberculin syringe with a 1 ml of sterile water inside that I ready. So now I'm gonna open it, sir. And then let's just relax po. Sir. Alright. So for intradermal, we will gonna inject it 15 degree angle to our patient. This is a skin test. And now push the tuberculin, the plunger of the tuberculin syringe. That's it. After that, let us now pull the tuberculin syringe. Alright. And then, put some cup. Then, place it on a cup containers. So now I remove the gloves. And then, hand hygiene. That's the end of our process on how to do the intradermal injection for our patient. Thank you.